The pager went off at 4:23 a.m. code red. Emergency department overwhelmed. Dr. Sarah Chen had been awake for 19 hours already. Another double shift, another impossible day. She looked at the message, then at her exhausted colleagues, then at the picket line forming outside. The choice was brutal. Work another shift and collapse, or join the strike and watch patients suffer. This was what Keir Starmer's NHS had become. December 2024, Labour's first winter in power, and the NHS was already breaking. Waiting lists, 7.8 million and climbing. A&E waiting times, worst on record. Ambulance delays, patients dying before help arrived. Starmer had promised to fix this. NHS is my number one priority, he'd said during the campaign. Instead, he was about to make it infinitely worse because the junior doctors, the backbone of the NHS, were preparing to strike. Not for a day, not for a week, for months. And Starmer's response? Refused to negotiate. How did it get this bad? Rewind to October 2024, Labour's first budget. Rachel Reeves stood at the dispatch box announcing NHS funding increases biggest investment in a generation. Sounds good, right? Except the money came with conditions, efficiency savings, productivity targets, restructuring plans. Translation, do more work with the same staff for the same pay. Junior doctors already working 60-hour weeks, already earning less than they did 15 years ago, adjusted for inflation, were told to be grateful. The British Medical Association wasn't buying it. They'd been negotiating with the previous government for 2 years, strikes, talks, temporary deals that solved nothing. When Labour won, doctors hoped things would change. Surely a party that claimed to support workers would support NHS workers. Wrong. Wes Streeting, the new health secretary, made Labour's position clear. We can't afford above inflation pay rises. The money isn't there. Junior doctors heard that and asked a simple question. Where did the money go? Because NHS funding was increasing, but it wasn't reaching frontline staff. Instead, it disappeared into management consultancies, restructuring programs, and expensive administrative reforms that achieved nothing. Dr. Robert Kayani, BMA Junior Doctors Committee Chair, put it bluntly. We're not asking for luxury. We're asking to afford rent and not work ourselves to death. If that's unreasonable, the system is broken. November 2024, negotiations collapsed. Labour offered 4.5% pay rise. Inflation was running at 4.2%. Real terms increase, 0.3%. After years of real terms pay cuts, after carrying the NHS through COVID, after watching colleagues quit for Australia and better paid jobs, junior doctors were offered basically nothing. The BMA called a strike ballot. Starmer's response was dismissive. We've made a fair offer. Further strikes will only hurt patients. Translation, take what you're given or we'll blame you for NHS failures. The doctors voted 98% in favor of strike action. Starmer still didn't blink. December 2024, the strikes began. Not token one-day protests, rolling strikes. 3 days this week, 4 days next week, building towards total withdrawal of labor. Emergency care continued. Doctors wouldn't let patients die, but everything else stopped. Routine surgeries canceled, outpatient appointments postponed, diagnostic procedures delayed, the NHS ground to a halt. And the human cost? Devastating. Cancer patients waiting longer for treatment. Hip replacement patients in agony for months more. Mental health assessments pushed back indefinitely. Labour's response? Blame the doctors. Wes Streeting gave interviews calling strikes irresponsible and ideological. Starmer refused to intervene. This is a matter for the health secretary and BMA to resolve. But he wasn't staying neutral. He was backing Streeting's hardline position. No new money, no compromise, just wait them out. The calculation was political. Cave to doctors, and every public sector union demands the same. Stand firm, and eventually doctors return to work. Except junior doctors weren't backing down. Because this wasn't just about pay anymore, it was about respect. Dr. Emma Collins, working A&E in Liverpool, posted a video that went viral. I worked a 14-hour shift yesterday, saw 47 patients, earned £14 per hour after tax. The health secretary earns £67,000 a year and works banker's hours. He calls me irresponsible for asking for fair pay. Who's really failing patients here? Millions watched. Public opinion started shifting. Early December polls showed 60% blamed doctors for strikes. Mid-December, 50-50 split. By late December, 55% sympathized with doctors. Labor's strategy was backfiring. Then came the incident that changed everything. December 18th, 2025, Manchester Royal Infirmary. An elderly patient, Mary Thompson, waited 9 hours for an ambulance, suffered a heart attack during the wait, died before reaching hospital. The story made national headlines. Labor blamed the strikes. If doctors were working, she'd be alive. The BMA blamed chronic underfunding. If the system was properly staffed, she'd be alive. But the public asked a different question. Why is our government fighting doctors instead of fixing the NHS? Starmer gave an interview defending his position. We can't negotiate with strikes holding the NHS hostage. Dr. Kayani responded within hours. The NHS is already hostage to your refusal to invest in staff who keep it running. The contrast was stark. Starmer, polished, political, talking about fiscal responsibility. Doctors, exhausted, emotional, talking about patients dying. Who did the public believe? December 19th, junior doctors announced Christmas strikes. From December 23rd through January 2nd, minimal staffing, emergency only care. The busiest, most dangerous time of year for the NHS and doctors were walking out. Media went into overdrive. Christmas strike chaos, and doctors abandoned patients. But something unexpected happened. Public anger didn't turn against doctors. It turned against Starmer because people saw exhausted doctors on picket lines, many crying, many apologizing to patients, many saying, "We don't want to do this." These weren't militant troublemakers. These were healthcare workers pushed beyond breaking point. And Starmer still refusing to negotiate. Conservative opposition pounced. Kemi Badenoch called it Labor's first major failure. Even some Labor MPs started breaking ranks, backbenchers from constituencies, with major hospitals facing constituent fury. One Labor MP told reporters anonymously, "Starmer's handling this terribly. We're losing voters over this." December 20th, 2025. Today, the Christmas strikes are 3 days away. Starmer faces a choice. Negotiate now, offer real money in the strikes. SAS, look weak, but save the NHS. Stand firm, let strikes happen. Blame doctors, Das, look strong, but patients suffer. His team is split. Some advisors, cave now before Christmas disaster. Others, stand firm or every union thinks they can win. West Streeting is reportedly furious. He staked his reputation on breaking the strikes, and it's not working. Rachel Reeves is worried about the cost. Meeting doctor demands means finding billions. And Starmer, paralyzed by the political calculation. Meanwhile, on hospital picket lines across Britain, junior doctors are preparing for the longest shift of their lives, not treating patients, but fighting for the future of their profession. Dr. Sarah Chen, the doctor from the opening, stands outside her hospital with a placard. Fair pay saves lives. She's been a doctor for 8 years, wanted this job since childhood, loves helping people. But she's also 80,000 pounds in student debt, can't afford to buy a house, works hours that would be illegal in any other profession, and earns less in real terms than doctors did 15 years ago. Is she asking too much, or is the system asking too much of her? The cameras turn to number 10. Starmer sits in crisis meetings, calculating political risks, but outside, the real crisis continues. Patients waiting, doctors striking, the NHS collapsing, and the prime minister who promised to save it, fighting the people trying to keep it alive. Who wins this battle? The government with all the power, or the doctors with all the public sympathy? 3 days until Christmas. 3 days until the strikes intensify. 3 days for Starmer to decide. Does he blink, or does he let the NHS burn? The answer will define his premiership. Because this isn't just about pay anymore. It's about whether labor actually supports workers, or just claims to when it's politically convenient. The junior doctors are watching, the patients are watching, the country is watching, and Keir Starmer, he's running out of time. The picket lines are forming, the winter is coming, the crisis is here. What happens next will determine everything, but one thing is certain. The doctors aren't backing down, and neither is the prime minister. Something has to break. The question is, what breaks first? The doctors' resolve, or Starmer's government? December 20th, 2025. The clock is ticking.